going on?
I have a lot of low back pain,
Okay.
actually, and then a little bit of like upper back pain as well.
When did that start?
Well,
Let me grab a
like
stool.
a few years ago, maybe like a year or two ago.
Nice. Okay. Well,
When
not
it
nice.
became-
Sorry, patient. So this is chronic, yeah?
Yeah.
What do you think is causing it, or caused it initially?
Honestly, just studying a lot and the posture of.
Okay. No car accident, fall, crazy injury that you
No,
can
I
think
am a
of?
climber though. So
Oh,
I
that
rock
plays a
climb
big
lot.
role into it.
Yeah.
Any specific work trauma? Maybe like were you lifting stuff while working, or any previous jobs where you're doing heavy lifting kind of thing, or
No,
just being a medical student?
just being a medical
Yeah.
student and a climber.
This is med student next.
Yeah.
This is what- And you're just like, I'm so stressed. Why am I so stressed? Okay, so that's good to know. Any radiating, shooting pain down your legs or your arms?
No,
No weakness, numbness, tingling.
just occasionally on the
Okay.
Mickey
okay.
side.
What part of your hand? This side? Ulnar
These
nerve?
two, yeah.
Okay. Does it happen when you're waking up in the morning? Like you wake
no,
up with
usually
it?
at night.
At night?
Yeah.
Okay. Any injury where you're climbing and you had to really catch yourself? Yeah. Okay. This happens in bowling too. You strain a little bit of that nerve.
Yeah.
Any migraines, headaches?
Very rarely.
Rarely. Okay. The reason I ask is people with tension up in the back often get cervicogenic headache. No whiplash, injury, concussion?
No.
Anything else you wanted to tell me you haven't? No?
No.
Digestive issues, that stuff's fine.
Fine. This is a great. Not
Okay.
really.
Okay.
Not great.
It's not optimal.
Not optimal.
How's your diet?
I'm pretty healthy.
Pretty healthy.
Yeah.
Eating whole foods, staying hydrated. Do you drink electrolytes?
Hydrated?
Do you drink electrolytes? No. So when it's this hot out, something to think about. Supplements, vitamins, stuff like that. And how do you sleep? Do you sleep well at night?
Up to 6
tossing,
hours.
turning? Bet
Up
you
to
get
6
about 5
hours,
to
toss
6.
and turning.
Okay.
Yeah.
So patient like this, right? I'd talk about magnesium supplementation, sleep strategies, meditation, like things just to help calm her down. You can lie on your back for me. So now, we'll kind of like, I do a lot of physical examination while I treat, which is it takes a lot of learning curve, so you might not see a resident do it this way, but as a residency director, I guess I can cut corners a little bit. So when I start, you want to reset your hips here? You can come closer. Did you reset?
I just did, yeah.
Okay. Okay. So I'm starting at the bottom because that is her interface with the earth, right? The thing that keeps your body structure in its alignment is your eyes lining up with the horizon. So your eyes like to be level and the bottoms of your feet like to be level. Everything in between those takes a zigzag pattern just to let that happen. We call that a tensegrity architecture. So if you look up tensegrity on Google, you'll see all these crazy weird looking structures and stuff. That's how our body is made. It's struts and pulleys. Struts being the bones, pulleys being everything else in between. And then I'm just really feeling now up higher in her body based on fascial tension. So let's see. So you got a bit of that preference here. Do you get more lower back on the right side?
On the left, actually.
On the left side?
Here.
Okay. Because she has a twist like this, which is kind of a typical pattern. Any pain in here?
Yeah.
Yeah, so her arches are really tight in her feet, which means there's superficial backline pull from under here up her whole chain to the base of her skull. So gonna just...
Yeah, that's a trouble ankle.
Yeah. Sprain it a lot?
Yep.
Okay. Like inversion?
Mm-hmm.
Yeah.
It's weak.
So yeah, we're gonna work on this talus. You have an anterior talus on this side. So okay. Knee pain?
No.
Okay. So working our way up. I'll check the hips here. Yeah, so your inflared anterior on the right, posterior and outflare on the left. Tender. Yeah, sorry. Hip flexor dysfunction on this side. So psoas iliacus dysfunction.
Great.
How do you do with direct work?
I don't
guess
think I've
we'll
ever
see.
had it.
I guess we'll see. Can you breathe? Don't forget to breathe. How often do you climb?
Like 4 to 5 times a week.
Where do you go?
I go to a gym in Philly. It's
Is
called
it-
Movement.
Oh, okay.
Yeah.
Have you ever been to the one in East Falls?
No.
That's pretty cool. I just wish I remember the name. There's also one in near Chinatown, kind of, in Philly. You all right?
Really? Yeah, I'm good.
Okay. So right now I'm contacting her psoas. So the psoas is one of the deepest hip flexors. It sits. You okay? Okay. It's really tight.
Yeah, it's bad.
It sits, right from the lumbar spine going down to the femur, and it causes her knee to kind of go up like this. It's one of those hip flexor muscles, so I'm just loosening it up. Checking, fair, not bad. Any pain with that?
Mm-mm.
No piriformis issues.
Amen.
Any questions so far? Okay. Any pain here?
On the back.
Yeah, so you've got some glute tension going on. Push towards me. Yep. And relax. Push again. Relax. And one more time. Relax. Okay.
Back.
Okay, it's starting to improve. There's a lot left. When were you treated? Ever?
No, never.
She's never been treated. So I talk layers of the onion quite a bit. She has a lot of layers to peel before we can get some of this dysfunction out. Lock your fingers like this. Support your neck. Keep that tight, but your body loose. I'm going to pull you towards me. All right. Check this side. And check this side. There it is. Okay. Line your right side facing me. So, lumbar rotation. Drop this leg off. You all right?
Mm-hmm.
Okay.
Ooh, my leg got numb.
You're what?
My right leg got numb.
There you go. Bring your hip backwards. 3, 2, 1, and relax. So now I'm just kind of aligning her lumbar spine. Do that again. And relax. Okay, let's do the other side. Scoot a little bit towards me. There you go. So sometimes I'll describe OMM like a healing martial art form. So it's almost like I'm doing inverse jiu-jitsu. And I know that because I treat a lot of Brazilian jiu-jitsu competitors, and they were like, dude, like you're doing jiu-jitsu, but the opposite. And I was like, what? They're like, yeah, you're like manipulating things to realign it, not to like break it. And I was like, oh, okay. As long as you're feeling better, dude. And then line your back again. So, I don't know. I have fun with it. I don't feel like I actually work, which is cool. I feel like I just do my thing, lift up, and back down. And people feel better, and then they tell their friends and family, and then I'm booked for a while. So. Okay. Yeah, we're getting there. But your rectus femoris here. Is that really bad? Yeah, that's bad. So major quad muscle, rectus femoris, AIIS to the patellar tendon. This crosses 2 joints. All the other quad muscles do not. They cross 1 joint. So this muscle oftentimes causes some problems. So I'm just going to do some FDM. We don't even teach students FDM, so fascial distortion model. Have you heard of it?
No.
So there's a new OMM technique that is being studied. I just published something on it, meta-analysis on it, that you essentially use some deep pressure along trigger bands in the body, and you allow them to kind of get pushed back into the right place. You okay? Some people will not be able to tolerate it, but I think she can handle it, so I'm just doing a little FDM here. You all right? Yeah. Okay. Take a deep breath. Might be a little sore. Keep going. Deep, 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 deep. Good. Okay. Yay. Okay, we're getting there. So see how I'm like, it's like you're untangling a tangled string. You want to start at one end. You don't want to start in the middle. right? Because it just gets more tangled at either end. So starting at one end, working my way up. Any questions so far? Okay.
How many sessions do these usually take to fully build them up?
It's kind of like asking, how do you know you're done with a painting? You know, it's like sometimes you just know. Sometimes the patient stops coming in because they're not in pain anymore. So you're like, okay, I guess we're done. Sometimes patients I've seen every month for the last 10 years, and they will always come back because they're in a preventative mode and mindset. Some patients will come in once every 5 years because they just come in when they're breaking down and they can't move. And then I'm like, dude, you got to come in more. Like, I can't just keep fixing you after years of accumulation, but that's just how they behave. So that's hard to say. Technically, in the moment, you can tell something is improved by rechecking. We call it reassessment. Whether the motion is improved, the symmetry is improved, the tissue has kind of released. That again, I'm not measuring it with like a device. I just know, like you can feel it happen. And that's what we teach our students is how do you feel something that isn't objectively right in front of you, that is subjective in your interpretation of it. So all that to say is like, you just know after doing it for a while when something has improved, right?
This is more on the sports medicine side.
Yeah.
But like, I know you deal with jiu-jitsu injuries
Yeah.
sometimes, and a lot of things with the trainers say, like what the trainer says is that like some injuries like they never really fix themselves, like hamstring injuries, like when they're pulled. So like, what do you do about those?
I would love to debate that person because I would say, I know, right?
Wait, not too much on that.
I would say it depends. Everything depends. Like one of my colleagues just said, he's like, no body reads any textbook. No body really cares. It just does what it does, and it's our duty as a physician to understand that patient and what they might need to get them better. So I would say it depends on the case. Some hamstring injuries might be so severe and so past a certain point, then yeah, you can't fix it meaningfully, but maybe they don't need it to be fixed. Maybe they just need it to be enough for them to get through the day or enough for them to take care of their family or go to the grocery store or something. So I think even the concept of something being fixed is up for debate. That's why I say that. I don't like to think in a rigid way. I like to think on based on certain variables and constraints and tactics and strategies. So it's kind of a non-answer, but an answer, I guess. All right, so I was just releasing core, ribs, diaphragm, respiratory diaphragm specifically, because that is going to help with like any digestive issues. This feels very tight, like restricted a little bit. You okay? She's like, I gotta go to the bathroom real quick. So embarrassing. So now, checking paraspinals. You okay? Okay. Yeah, you were very twisted up.
Yeah.
I can see why you have back pain. Are you doing any self-PT?
No.
There's a YouTube video I'll show you that I give to patients for that. It's called the Lock 5 Ultimate Stability Protocol. I did it when I herniated my disc in my back years ago. And now I'm starting to sweat because this is physical work. I do not wear a suit when I see patients. I literally have an interview at 4 o'clock. Yes. Yeah.
What would you say is the best way to treat
Ooh. Again, it depends. So the sciatic nerve starts in the lumbar spine, works its way through the hip, down the back of the leg. There are literally like an infinite number of ways that can get impinged throughout that whole chain. Typically, it's impinged at the disc. So disc herniation is very common. I would say secondarily, what's very common is piriformis syndrome, where the muscle in the deep glute impinges on it because it's so tight that it seems like you have a disc, but it's really just the glute issue. So I would have to do a full history and physical to really know. But I do this, I do acupuncture, I do some injections for it. It's a pretty, I see it 10 times a day. So I generally can fix it in a couple visits. I just have to know why it's happening and how do we address the actual issue. Yeah. So we have an office here and an office in Sewell. I only see patients in Sewell a couple days a week, so spots are pretty limited, but we have residents that are pretty easy to get in with sometimes. So you just call the NMI, call the office, say, hey, I want to schedule for OMM, who's available? Some people ask for me by name, and that I do have quite a substantial wait list. Sorry. So it kind of depends what you're willing to who you want to see to get OMM. But I would call the NMI, to get evaluated. So I'm working on her trap, right? This muscle that everyone has issues with all the time. That's why she's squirming a little bit. Yeah, you have a question?
Is there a good way to crack her neck?
There is, and I might have to, we'll see. But yeah, it's one of the techniques, we teach is cervical HVLA, thoracic HVLA, high velocity, low amplitude. Now I'm working on her pec right here. So there are ways to do that. Sometimes it's indicated, sometimes it's not. Like if she was a 90-year-old osteoporotic woman, I would not do that. You are asking for a fracture. But she's rock climber, pretty tight, probably has some. We already did that on her lower back. You guys might not have seen it happen really quick, but you might hear a pop, a click. You might not hear a pop or a click. That doesn't mean it didn't work either. So that's just what plays well on social media. So people click on it, see it all the time. They're like, oh, that must work. And it can, but it can also end very poorly too. Of course, they're not going to show that online. Be like, oh yeah, patient has had a stroke now. Like, great. That's not going to sell business. You okay?
Yeah.
It's your
Double
lat.
subscap? No.
It's your lat.
Ooh.
Yeah.
I have a follow-up to that.
Yeah.
So I know people who actually crack their own necks in their back.
Yeah.
Is that okay to do, or wouldn't you say that should be done with a professional?
I have a lot to say about that. So first thing I would say, oftentimes it's related to behavioral components and stress. Some would actually call that a type of nervous tic, where they feel stress accumulating and then they're just like, oh, and then they're like, oh, I feel so much better, right? If they're doing that but don't have pain when they do that, I don't think any study has shown that it is physically bad for the joint. However, if they're a hypermobile patient based on their genetics, then it can be detrimental over time to both do it yourself and have a chiropractor or even a DO doing a lot of adjustment that way, because your genetics don't allow that to be helpful. You get joint laxity, your ribs start popping out all the time, you can't really control that. But I think when someone is doing it, like even I'll do it on the foam roller every day, like I'll feel a bunch of cracks in my back. I don't think it's like a bad thing. I think it's just, it really what it is, it's a cavitation. So there are pockets of little gas bubbles inside of synovial joints that when you add enough compression, they get released. And then they accumulate over time again. That's why you can't do it repeatedly. So I think more of it's kind of like a self-response to stress and anxiety. Like someone who's just like, crack your knuckles. Even I'll do it subconsciously. I'm like, oh, let's get ready. But it's not a bad thing necessarily. So, yeah. Mm-hmm. I think every question I answer is going to say depends. Location, is it always constant? When did it start? Was it since birth? Is it part of just your bony structure? Is it part of a behavioral you're doing? Is it part of a sport you're doing, an occupation you're doing? So I would have to take a full history and physical to really know if it's fixable. So I don't know. Yeah, it's complicated. Some people will see something cosmetically, they'll be like, oh, I got a hump here. Like, I got this hump. I'm like, yeah, when did that start? Oh, 10 years ago. I'm like, they're like, can you fix it? I'm like, probably not. But if I were to fix it, it wouldn't be me, it would be you. Patients are like, what do you mean I'm gonna fix it? I'm like, well, you started it. Like, you gotta be the one to fix it, meaning whatever behavior you have that caused it, whether it's not exercising, sitting, eating too much, all this stuff that accumulated for your posture to do this, for that hump to develop, you got to start reversing that. And it might take as long or longer for you to do those behaviors that caused it, right? So if it took 10 years to start, it might take 20 years to fix. That's why I think it's better for us to be proactive about our health than reactive, because it's a lot easier to stop something before it starts, right? Anyone else? Yeah.
This kind of goes off like the previous question,
Ooh,
but it's a little short and stupid. But does cracking your knuckles cause arthritis? Because my mom says
No.
you'll get arthritis.
Nope. Just tell her I said no. Yeah. Yeah. You're welcome. There's been no documented evidence for that to cause arthritis. Well, we'll go this way and then we'll go back that way. Yeah.
I wanted to ask, why is it like more comfortable when like sitting in an unusual position than when like sitting like normal, or like just like a
Depends. How do you mean unusual position?
So like I don't know, yeah, like or like I don't know, doing a split is like more comfortable than just sitting normally. I feel like that's how I feel. Like,
It wouldn't be comfortable for me. So what I will say about positional change with regards to seated postures and different postures is your body never likes to be in the same position. That is literally how we were built. Humans didn't evolve with chairs. We didn't evolve with computer desks. We didn't evolve with any of this. What we did evolve with is like caves and mud and dirt and sitting like literally in this position for like 7 hours. So it's like, the reason you probably intuitively feel that it's good is probably it is good for you to change position. I see a lot of desk workers, like career desk workers, who are like, yeah, I've been sitting in the same chair for 20 years. And I'm like, well, that's why your whole back is like exploded. Like you just haven't changed position, exercised, taken care of yourself. It's like your car. It's like you've driven it 100,000 miles. You've never gotten an alignment or an oil change. And you're surprised that it can't drive anymore. It's like obvious, right? So, yeah. Anyone else? So, yeah.
How do you incorporate your art skills into OMM?
I'm doing it right now. Really, it's through adaptation. So, like, if you make a mistake in art, is it really a mistake?
No.
It's an opportunity, really. So, like, yes, I can make a mistake, meaning like I hurt somebody or like something bad happened. Yes, but what I'm really saying is that I am very comfortable with adaptation. Even right now, like, I don't know that I've treated someone at the same time as answering questions to like a bunch of high school students. So this is a first for me, but it is, I'm comfortable, right? It's like, as an artist, you get comfortable in the unknown, you get comfortable with your hands, you get comfortable doing things subconsciously, intuitively, going with your gut. I think art has created a very unique foundation for me to help people, and it doesn't often occur to people to think of it that way, but I think because I've just experienced that, like that's just what I, see as what I'm doing. So I think the obvious reason is my hands, right? My dexterity. Like I can just feel immediately where the problems are, and she can probably attest to that because she's like
I'm dying
squealing
over here.
And then I think the more abstract way is in how art shapes your brain. Is art helps you connect with yourself, with like your intuition, with your subconscious. It allows you to be comfortable in uncertainty, and it allows you to be very creative at problem solving. So, yeah. But any other questions?
She did.
Wait. She didn't ask one yet, but then we'll go back. Yeah.
what's the most challenging part of the job?
That's a really good question. Nothing. It's so easy. No, I think the challenging part that I actually really like, so I think there's a difference between what's challenging and what's difficult. What's challenging is the unpredictability and the multifaceted nature of my job specifically. So I don't just see patients, right? Like I'm the interim chair of a whole department of both staff, faculty, administrative staff. We have to talk about profit margins. We have to talk about patient care and safety. We have to talk about training. We have to talk about teaching. We have to talk about research. So like there are an infinite number of variables I have to think about and consider. But as someone who's kind of like a gamer, artist, person who loves people, like I think that's fun. So I think the most challenging part is that multifaceted component and unpredictability. So yeah, I think it's challenging, but it's rewarding. It's like the reason why you wake up in the morning. We were never meant to just have an easy life. We were meant to have a challenging life that is stressful, and that we learn to make mistakes in, and that we improve because of those challenges. Like, I've been through some crazy stuff that I could tell you guys about. You'd be like, oh my God. But that's the reason why I am here and why I'm doing what I'm doing. It's because of that stuff. So, question?
No, I answered my own question.
I love that. I love that. Everyone's got to do that more. Just think about the question. No, what's your question?
What do you think are some key things you should? What are some key things in your past that you learned with your hands that you learned for now?
Trust them. I think we spend our whole lives telling our hands what to do. We spend very minimal time allowing our hands to tell us what to do. So what I mean by that is you got to think about when was the last time you put your hands on some kind of living thing like your cat or your dog, and then you listen to that animal and you're like, I feel like I should pet them like this. They like this, but they don't like when I do like that or something, right? Similarly with patients, right? Because I've learned to, there's a reason, I've been treating this whole time, and yes, I'm kind of there, but I'm also talking to you guys, but my hands are on autopilot in a way because I just trust them, and they just kind of know what to do at this point, but you don't get there overnight. So again, it's that motor skill, that muscle memory, that routine practice, and then you get more comfortable. It's how do you play the instrument without sheet music? Because you've played that instrument so much, you're comfortable at improvising and you know what the next thing is going to sound good. So I think what I've learned from my hands is that you can trust them. It just takes a lot of practice. Yeah. Good question though. I didn't even really think about that before. So now I'm kind of working her cervical spine. A lot of tension here. It's called med student neck, where you're like, you okay? Mm-hmm. Feels like a bass guitar string.
It really does.
Yeah. So this is something I might use acupuncture on. I'm also an acupuncturist, so I do a lot of needlework too. Yeah, any other questions? Yeah.
Okay, so I'm gonna ask the opposite instead of what's difficult, what's your favorite part, or what do you?
This treating, doing my art form. That's it. If you can love what you're, it's so cliche, but it's if you love what you do, then you really don't work. You just kind of wake up and go to work and enjoy it. So that is the whole reason I picked this as a specialty, was because I just loved it and I love doing it and I don't get tired of doing it. And I like teaching it. So I'm like, that's what I'm gonna do. It was a pretty simple decision. It wasn't really complicated. So I think what I love about what I do is the art form of it. Is that it's not prescribed a specific dose. To me, that stuff's boring. You can memorize that stuff. There's no room for creativity, really. If you get creative, you get in trouble, actually. Oh yeah, just take this thing. I think it'll be cool. No, but yeah.
Will we get a chance to practice on each other?
Want to flip over? Oh wait, actually stare at that. Let me check. That I can show you some basic stuff. I just got to be careful because you guys haven't been through the rigors of all of the training, but I will, in a moment, I will show you a very basic technique that you could do pretty safely, I think. So let's see, that's my legal answer. It is for back. You all right? So you're too tight to even articulate. All right, flip over. So this is a technique that I think can be done relatively safely. Now, I wouldn't do this for, again, someone with osteoporosis or any rib fractures or issues or anything like that, but everyone generally has tension in their upper back, right? So it's pretty simple. You just feel where it's really tight on the sides of the spine. So these bones here, your spinous processes, you don't want to go right on them because that can be kind of painful, but you go just to the side of them. Place your hands next to that spine and work those muscles, the paraspinal muscles, straight out to the side. So I'm just pushing and putting my body weight right on there. And you can wait for a bit because the actual fascia takes time to release and you'll feel it start to slide. It's called fascial creep. And you just kind of, so yeah, that's why you couldn't even get articulated, because this musculature is tight.
In
Yeah.
OMM, this is more of a question.
Yeah.
You guys do
Yes. You know how hard for me that was to just say one word? I talk for a living. So I will. So I learned to do cupping as a third-year medical student outside of our education at a private office that I was shadowing at of my own volition to learn. So I bought a cupping set on Amazon. I started to treat my friends, my family, based on what I learned on my rotation, and it seemed to work pretty well for a lot of people. This is back in 2013. And I've been doing it ever since. I've taught a lot of people how to do cupping. I learned it again in fellowship. And they were like, any questions? I was like, I already know this. And they're like, great, dude, like, whatever. Yeah, I was that kind of nerd in fellowship. But it was my acupuncture fellowship. They taught flame cupping, which I actually didn't learn yet. I learned the suction cupping that you can get for like $30 on Amazon or whatever. But yeah, we do it a fair amount. I do a lot of gua sha. I do a lot of Graston. A lot of Twina. Huh? Gua sha, yeah. No, I just do it because it's just a great placebo, and you know, people see it and they're like, "Whoa, that looks great." I'm like, "Yeah." I mean, you know, everyone has different opinions, always. Some people don't think doing osteopathic manipulation works. That's fine. It doesn't affect me, huh? I have not done coining, but I know all about it, and I know why and how it works. Yeah.
I never, like, can you explain how it works? Like, I do it, but, like, I learned it, like, I just do it.
So, yeah. So are you Vietnamese? Are you Vietnamese? Yeah. So in Vietnamese culture, right? And my wife is part Vietnamese, so I know all this stuff. So I'll just wait till they stop talking. Let me treat this. So coining, right? Does anyone else know what coining is? Oh yeah, what is going on? What is it?
Usually, because I know she uses it a lot when she's sick.
Yeah.
But yeah, it's basically like pain reliever, temporary pain reliever.
Okay.
When you're sick, it actually gets maybe
So what do you feel when you get it done?
pain. But like, okay. Okay, well, what, for like when I'm sick? I feel
Do you think it helps?
I think it helps, but that might just be a placebo because I
Okay. So my question is a placebo a bad thing?
No.
It's a pretty substantial effect. So it could be part placebo. It could be part your body's response to inflammation, which is actually a healing response. So we generally give inflammation a pretty bad name when it actually is our natural response to injury in our DNA. Acute inflammation is good. It can heal stuff. We do PRP, we do prolotherapy injections to create inflammation. You're paying a doctor to create inflammation. So where we get into trouble with inflammation is chronic inflammation. That's not good. That is not what inflammation is meant for, to be chronic. So with coining and with cupping and with all of these, I would say they look to be more harsh interventions that are temporarily kind of, bruising, let's say. They are little red flags you're planting in your body to pay attention. So if you're doing coining to your thoracic spine, underneath your thoracic spine is your sympathetic chain ganglia. What is that? That is the nerves that control your respiratory clearance. Like if you have an upper respiratory infection, you're going to have overdrive of your sympathetic chain ganglia. And so you're going to have a tougher time clearing mucus. You're going to be coughing. You're going to be like, oh, my throat is killing. So that is like getting the body to be like, hey, wake up, work on this area, release it, relax. So get the lymphatics moving because that gets more white blood cells to the area. So there are some studies that show that doing those interventions can spark an immune response. And so, yeah, maybe it is part placebo, but maybe it's not. Yeah.
Can that also happen with allergies?
Yeah. Some people, if you want to get really TCM, traditional Chinese medicine, if you have allergies, they'll take a hammer with little spikes on it and tap your brow line, and you'll start bleeding a little bit. and it clears your sinuses in like 30 seconds. Huh? It's in the same realm. Yeah, it's in the same language, because acupuncture is doing the same thing. It's just not as brutal. Like like I could poke you with an needle and get the same effect. It depends on what level your patient is comfortable with, too. No, it's an art form. There's like a spectrum to all this stuff, right? Yeah.
It's like the same thing when people have that roller spikes and they put it like on their face to like clear the act.
Kinda. Yeah, kinda. In a way. Push down. Yeah.
I never understood
Relax.
acupuncture really. Is acupuncture like using
Push down.
needles into like key points of the body?
You could explain it to them. Relax. Yeah. Yeah, so acupuncture, it's way more mystical than it really needs to be. It is essentially putting a semiconductor in a conductive field, which is your body, at certain points to create a certain effect in your nervous system. So it's like you're doing little microcircuitry work on your computer. You're getting rid of viruses, you're reprogramming, you're putting in new software. That's really what acupuncture is. It's nothing that crazy, and it doesn't hurt as much, nearly as much as people think. It just looks like it hurts, but it doesn't. Like, it just feels weird. It feels like you have a cramp, you know? You all right?
Is the angle of the needle what changes it?
Well, yeah. I mean, it's very anatomically dependent. So if you're off in your placement, you're not going to get results. You need to be precise about your placement and your depth and how you move the needle. Yeah, those are all factors in it. Yeah. Yeah. Tragus, yeah.
Yeah, because I got
Daith. Yep.
But it got ripped out, but
Ow.
yeah.
Yeah.
Like I really didn't have any headaches.
Right.
Well,
Yeah.
I gotta get that.
Yeah, if you look up auriculotherapy or ear acupuncture, it's a whole other subfield. I do a lot of it. It's actually very well studied in the US military for PTSD. Glute medius, glute minimus. So 100%. I think the research shows that piercing has a 50% chance of working. So you were probably in that positive field. So yeah, it works. Yeah, a lot of people do. Yeah. Uh-huh.
So, I'm an athlete, right? And before I race and when the track, we use like tiger balm, like something that.
Mm-hmm.
Does that really work, or is that like? Because I feel like it's very like on and off. Like some races it'll work, and then
Yeah.
some races it won't work. Or is it just like tension in my leg? Because I put it usually here.
Yeah, so with those topicals, right, if you look up the effects of menthol and other of those similar agents like Icy Hot, it changes your perception of pain because it's causing a different stimulus. So that model is called the diffuse noxious inhibitory control model, or the DNIC. What that essentially means is you stub your toe, your back doesn't hurt, because you're affecting your bandwidth processing of pain in your spine, where it can only process a certain amount of pain. So if you overload it with something else, it can't pay attention to the chronic thing. So you're kind of, same thing how cupping works and all those, if you're stimulating your skin because it's so highly sensitive, it's the most sensitive organ in the body for a reason. It's your outer defense. So if you're stimulating your skin, it's eliminating chronic things temporarily. That's why it works. Yeah. So maybe a little placebo, but it also has some science behind it for sure. Yeah. Yeah.
No, I
A
have.
state. I have to use the bathroom. No, I'm just kidding.
I don't know what it's called in English, but it's called
Where is it done? On the scalp, ears, or feet, or hands?
right on the forehead.
On the forehead.
Like you have like a really bad headache and then.
Yeah. Yeah. I've heard of Twina, which is done for infants. That's also like a type of subcutaneous pressure work. I haven't heard of that one specifically, but for headaches, you should treat this. You should do this.
She does that too. But
Yeah.
I think it's like right between the brows right here and then.
Yeah.
Tuck it and those squeeze out like all the.
Yeah, that's called in Chinese medicine's called yin tang. That is your essentially an anxiety point. So if you're getting stress headaches, yeah, you could either bleed that spot or put a needle in that spot, or literally stick a fingernail, honestly, and you'll calm down. So it's an overlapping acupuncture point. Some people call it the third eye point. That's another term for it, third eye. It's between your eyebrows, though. Yeah. You will. All right. I've seen it, they pop it. It's like, so, man, my brain's gonna be mush. I have an interview at 4. I'm gonna be like, kind of. So, that is the epicranial fascia. That is tissue that can get restricted. It's in the same line of fascia as the plantar fascia. So, if you have someone with plantar fascia, ask if they have the headache, and you'll be surprised because a lot of them do. Yes, you can actually HVLA like skin. Like you'll see a chiropractor like do one of these and like pop it, and it actually makes a sound. But I don't think there have been studies that show that it's actually anything other than placebo. But I'd have to look into the data. I'm personally a very pretty data-driven person. So if there's something without data to support it, I'm gonna just say like, here's my anecdotal experience, my personal experience, and here's what the data shows, and maybe you make your decision on that, but I just don't know. I've seen it though. From an anatomy perspective, yeah, I can maybe see why it relieves things because there is fascia there that gets restricted, and maybe that's causing a temporary fascial release. But other than that, I think it's honestly, the thing with social media is anything that looks crazy or that's controversial is gonna get more views. That's going to go viral, that's going to spread more people are going to try that, more people are going to spend money on that. So that's why, that's kind of one of the caveats of social media. Although it's great for education and things, but honestly, a lot of the stuff I see on social media, I'm like, no, absolutely not. And that's why I'm active, to try to combat that. So. Any other questions? Yeah. Yeah. 2 answers. What? Mm-hmm. Mm-hmm. Yeah. 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 Electrolytes. I don't think I've met many people who take enough electrolytes as a supplement, especially at this time of year. It has to be, it can't just be Gatorade blue flavor. Like it's got to be some actual electrolytes. So I like some brands out there, and they don't pay me, are like Element, it's like LMNT, that's not bad. I drink Keto Vitals because it's 0 sugar, keto friendly. I do intermittent fasting. But if you're not taking them in, like yeah, maybe you'll have salty food here and there, but you need magnesium, you need chloride, you need all these other electrolytes. And the other questions I would ask are, do you get eyelid twitching? Do you get constipation? Do you get calf cramps? Do you get migraines? Those are indications of low electrolytes. And physicians won't tell you that because it's not really explicitly taught in medical school for the most part, until maybe you get into residency or fellowship in like sports medicine or something like that. But what was your other question?
Do you have any skincare?
Yes. So, I mean, I'm Korean, bro. Like, yeah. So half Korean, but still, it's enough. So number 1 is facial cleanser.
Yes.
Number 1.
Wait, do you wash your face first and then put your facial cleanser?
I'll tell you. So facial cleanser is for washing your face, right? So I use, and then again, I'm not sponsored by any. So I use CeraVe foaming facial cleanser. It's a good one. Brand is pretty good, pretty reasonably priced. Now, I do that morning and night, okay? First thing in the morning, last thing at night. Second, chemical exfoliants. So I use BHA somewhat. I like Paula's Choice, it's pretty good. I don't use it every day, maybe a couple times a week. I would do that after your facial cleanser.
Wait, what is this?
It's called BHA. It's a type of light acid chemical exfoliant. So yeah, you can scrub the crap out of your face, but it's not good for your skin. So you want to use some kind of light acid to get all that dead skin off gently. Again, I use either, you can use a cotton pad, cotton ball, or your hand just to like do that. And And then you're getting a deluxe treatment. Flip over.
You really am.
Yeah, I'm like fighting now to find dysfunction. So that covers facial cleansing, exfoliant. Other thing would be sunscreen. If you want to look young for a while, like I'm 57, right? So you think? I'll let you figure out how old I am. So I'm not telling you anymore. So if you want to look young, wear sunscreen every day, even in the wintertime, even if you're inside, whatever. Like, there's no reason really to not, other than maybe price, maybe it's a hassle, maybe you forget. I'm not telling you. So do that in the morning after you do your facial cleanser. So bare minimum, if you're a dude, right? I'm a dude. If you're a dude, she's a dude, he's a dude. If you're a dude, do facial cleanser in the morning and sunscreen. A hydrating facial sunscreen, right? It can't just be like banana boat or whatever. It's got to, like I use like Neutrogena 60 SPF facial moisturizing sunscreen. That's bare minimum. Now at nighttime, you do your facial cleanser. You don't need sunscreen at night. You can use a retinol, okay? So retinol, right? It helps collagen production in your face and your skin. Now, if you don't want wrinkles, and if you want to actually have a youthful looking appearance, you can use retinol at night. However, some people are sensitive to retinol, so it can feel kind of spicy. Take it slow initially. Maybe it's once every other day. Luckily for me, used to it, I don't get spiciness on my face. So I use that every night. Now, outside of that, we're getting into the extra category, all right? What? Yeah, like toner. You can use toner. I don't as much, like I just don't. So facial toner helps like even the kind of complexion, right? I use a caffeine drop under eye. Yeah, it is. It's original. Yeah. So caffeine drop tightens the skin under your eye. So if like sometimes I have a toddler, I don't sleep, I got bags going on. I'll just put a caffeine drop, tightens it up, we're good. Do you have any recommendations? I don't know.
Vitamin C.
Vitamin C, yeah, there's good data behind vitamin C too. One of my dermatologist friends told me, she's like, yeah, vitamin C is good.
Potentiates your sunscreen.
Yeah, again, like she said, potentiates your sunscreen. What does potentiates mean?
Just makes it work better.
Synergizes, improves. Yeah.
What are like some common like skincare myths that you've seen online that you feel like are too like
Skincare myths. I don't know. What do you think?
Not every hyaluronic acid works.
Not every hyaluronic acid works.
That's not a myth, that's a truth.
It's a truth, yeah.
Some of them don't penetrate your skin.
Some of them don't penetrate your, I'm just repeating what she's saying. I don't know as much, I'm not derm necessarily, I'm just a Korean guy, but yeah. Yeah. I can treat someone for like 10 hours, so she's getting a deluxe everything. We'll take one more. Yeah.
So, I know you mentioned retinol.
Uh-huh.
It's like panoxide for my acne.
Uh-huh.
Those would probably go bad together, right?
I don't know. Not my specialty.
Oh.
Yeah, I don't know.
Don't
Any
do
other?
it.
I'll give you one more. Yeah.
This is kind of a stupid question, but you mentioned like electrolytes and how we need to like take more of them.
Uh-huh.
Do they have like a taste to them, like if you add them to the stores?
Yeah. Look up. Do you have Amazon on your phone?
Yeah.
Look up Keto Vitals Electrolytes. Yeah. Keto. And they do not sponsor me. I really wish they did, because the amount of business I give them is ridiculous. But Keto Vitals Electrolytes has like 50 flavors. I drink mango. I've tried almost every single one. Mango is my jam. They have packets, but I drink. I know they should. I should just make my own. I drink the tub because it's cheaper. I just keep it at my desk.
No, my trainer's really nice.
Well, if you have more questions, send me a DM or email.
What's your Instagram?
dr.alex.king.
We're following you right now.
Is this how you do cranial?
Sometimes from the side, yeah, so I can answer questions.
Wait, Corbin, I can send you
I